As David said, I'm Mark Buffington. I'm the founder and managing partner of BIP Capital. I think it's fair to say that we've been one of the South's most active venture investors over the last decade or so. I've got all the scars and a few of the triumphs to prove it. But it's been a great ride. We've had the privilege of partnering with some fabulous entrepreneurs and to invest in some great ideas. Over the last 7 years, we've invested about $140 million in 23 early stage and growth stage companies, and our predominant focus has been healthcare IT. People always ask me what type of businesses we're looking to invest in, and I generally say, as it applies to healthcare, we're looking for businesses that do one of three things. That's improve the quality of healthcare, reduce the cost of healthcare, or provide greater accessibility to healthcare for those in need. And our panel today are people who are working on one or all three of those things. So I'd like to bring the panel out now. And I'm going to start by asking each of the panelists to introduce themselves and talk a little bit about their business and the grand challenge that you're working on now.
So I'm Amy Baxter. I'm a pediatric emergency doctor, and my problem is pain, particularly healthcare's indifference to pain. So my innovation was a combination of the two oldest solutions for pain. Cold is as old as ice, and vibration is as old as having hands and rubbing a bumped elbow. So the combination of cold and vibration together we call buzzy and use for pain. That was the innovation. The disruptive part was the concept that you could use cold and vibration for needles, and you didn't need to be in healthcare to do it. So our device is something that primarily from the beginning was offered to patients. Now we're expanding to runner's injuries and chronic injuries that have been more traditionally treated with massage and vibration. But the initial innovation was trying to get patients aware that they could control their own needle pain.
That's great. Lucy?
Sure. Thanks, Mark. I'm Lucy Ide. I'm CEO and one of the co-founders of Remedy Diabetes. My background is in mobile technologies, and then I have both an MD and a PhD from Emory University, and decided to take that healthcare background and combine it with the technology background and started Remedy, which is a health IT company focused on improving the quality of life for individuals with chronic conditions. We're initially focused on diabetes because there's this large disconnect between what's understood about how to manage diabetes and what happens in real life. And diabetes management stays ineffective and inefficient and very costly. And so it's a huge problem as well. As most of you know, 1 in 10 Americans today has diabetes, and that's projected to be 1 in 3 by the year 2050. And so we're really looking at what's needed to break the status quo and to improve outcomes there, and enhancing education, providing the right tools for better management, and really driving commitment by both patients, providers, employers, family members, everybody who's needed if we're going to change the system.
Shane.
Yeah, thanks, Mark. So you may be wondering, any of you that read Ed's paper, the Atlanta Business Chronicle, and maybe saw on Friday where Jackson Healthcare won Best Places to Work in the large company category, which that's my little plug there for us. We'll be up here, the group of small entrepreneurs, but we actually have a fairly unique business model in that Jackson Healthcare is really the parent company comprised of now about 17 different small entrepreneurial businesses. We're very big believers in the power of focus and specialization and what a small, empowered group can do. And so we are facing challenges on a number of fronts within healthcare, but primarily centered around patient access to care. and talk a little bit more about that. But with the shortages of physicians in particular and other problems inhibiting patients being able to get care, that is the primary theme in which we're creating our businesses.
Yeah. In full disclosure, Shane and I have a collaboration now, so
That's right.
to solve that exact thing. So, Partha.
So my story actually starts when I was 19 and I broke my ankle playing basketball. I spent 6 weeks on crutches and I hated the experience. Thought there had to be a better way. So we spent some time talking to orthopedic surgeons, physical therapists, patients, and we realized that the crutch really hasn't been changed in 5,000 years. I mean, there's ancient Egyptian drawings where they used crutches. Thought there had to be a better way where patients can't hurt their underarms. So that's what we did is we created, and this is during my time at Georgia Tech, we created a crutch that you can't hurt your underarms with. And then I added what I like to call the entrepreneurial double major, which means I just stopped taking classes and started building the company.
That's great. I'm going to ask each of the panelists, if you're successful, what type of impact will your company and your idea have on the efficacy of our healthcare system? Maybe start with you, Amy.
Sure. I think that we have grown so reliant on Western healthcare that we look to doctors to provide even something as basic as our own comfort. So if we are successful at our company, Buzzy for Shots, then what healthcare will look like is people will know that they can go to their own medicine cabinet and they'll have a variety of different ways that they can use common things, cold, vibration, and they will anticipate applying them themselves when they need it, to give people a little bit more creativity in how they approach health. I've seen people in the emergency department who have a tiny, small spot of a scab, and they come to us to flick it off. I mean, we've really gone through a place where people don't feel comfortable trying things to help their own bodies. And so I think that that's something that physically, for something like pain, to feel like you don't need to go to the doctor and hope that they do something to address your shots, you bring it with you. You don't need to go to a pharmacy and get a prescription to do something to help your back pain. You've got something you can put on and take care of it at home. So I think a little bit more empowerment and a little bit more of doing what you personally need rather than having a one-size-fits-all treatment that only comes from on high from the doctors.
Yeah, and keeping people out of the emergency room obviously is a huge cost driver for us. So.
Unless they have something fun.
Yes, yeah. So Lucy, how will Remedy impact healthcare?
Right, so I mean, the numbers are so big in diabetes, and it's often talked about. I mean, this 1 in 3 number that I just spoke of is really staggering if you think, look to your left and right, and by the year 2050, one of you would have diabetes. And that comes at a huge cost. I mean, the cost number's $500 billion by 2050. And those macro numbers can be sort of hard to relate to of how can we impact that. There was a big United Health Group study that said about 250 billion of that is preventable. We could impact that through a variety of ways. And so, we realized that we're part of that ecosystem, right? So part of it's prevention and bending the curve on obesity that's been talked about a bit this morning. But then part of it's making that management more efficient. And there's a lot of blame of patients involved in this particular disease state of not, they don't engage, they don't care about their disease, and there's a tendency to want to put the blame there, but it's really a systems problem. Mm-hmm. And so, I think it's going to take many companies and innovations like ours working on different pieces of this. And if we can each have, $100 million, $200, $300 million impacts on it, we can get to that, multi-billion-dollar impact we can have on the system.
Yeah. And Shane, you're already making a big impact with supplying physicians, but maybe talk a little bit about how you're leveraging that asset to find other ways to create a greater impact and improvement in the healthcare system.
Yeah, sure, thanks. So there are some just big mega trends that everyone knows about that we've really centered our business around, being an aging population, demanding more care, more people with access to the system, due to being able to have insurance coverage and other things. And then, so that's on the demand side. On the supply side, you have a limited number of physicians in particular, but care providers of all training. And on the physician side, we have legislative limits on the numbers of physicians that we can train and put through residencies and those sorts of things. And so you have this growing demand with a stagnant supply, and that causes challenges. And so We're trying to work this on a number of fronts, but there's a limited set of solutions to those problems. And so you think about the use of advanced practice providers, or so-called mid-levels providers, physician extenders. You think about variable staffing solutions, which is a big thing that we work with our clients on. There's technology and efficiency solutions, which we like to think about. And so, but where we really see our business going, and these are some of the conversations that Mark and I have had in the past, is in the intersection between all of those. And so leveraging this physician network and resource that we have and technology available through things like telemedicine, to be able to get a more effective use of the physician's time, leveraging physician extenders and those sorts of things to be able to work on the other side, so that you have patients who have the timely access to the physician expert at the time that they need it. And that's a lot of where we see our business going.
Yeah. Partha.
So at Better Walk, our whole vision is to really, and it starts with the Better Walk crutch, is to put out products that say, yeah, there is a better way to do this, and we've kind of been doing the same thing for a long time. So that's just the first in a series of products that we'll introduce, but the whole idea is that, look, we can create innovative solutions that solve problems that have been around for a while and have really been ignored because there wasn't really a financial incentive to do it. But you can create these solutions that are financially better for hospitals, and like you were saying with the companies that you invest in, you can save money and improve patient outcomes at the same time. So why aren't we doing it? And that's kind of why we started the company.
Yeah, great. So let's face it, scaling a business is really, really tough. There's raising capital, there's getting the right people on board, et cetera. Can you guys talk a little bit about the challenges you've had in scaling the business, both internal and external? And I'll start with you again, Amy.
Well, I chose some really circuitous and non-traditional routes. I went on a show about fish, Shark Tank, and while I did not take the capital they offered, the actual Google Analytics of the time when we went on Shark Tank looked like a shark fin. It's like blue, blue, blue. Whoa, big fin coming out of the water. So the downstream revenue effects from having gone on commercial television were huge. In addition, we've gotten a number of grants. Most of our grant funding came from the NIH, which through the SBIR program. So scaling has really been almost leapfrogging from one grant to another for us, and then bootstrapping the rest of the way. And the Chase Small Business Grant this January was actually phenomenal because it was $250,000 that came just when we really needed to invest in the inventory so we could meet the demand for Shark Tank. So it's been incredibly providential, but that's really it. I don't recommend all of those steps to everyone, but it's worked out for us.
So have you had challenges getting revenue to scale, or it just sounds like that's gone pretty well for you, at least after Shark Tank?
Yeah, it's actually, we have 3 different markets. We have a B2B market for people who are doing injectables so that they can give a buzzy with their really painful shots, not just for the needle, but so you can rub it on while the medicine's burning and then not delay. So we've had really good success in lots of countries internationally, people buying for that. We're just accepted to be on QVC for more of the runner's injuries and the aches and injuries part of it. And then direct to consumer, that's as easy as Amazon. So all 3 of the different revenue places have kind of been, our markets have all been rising in concert with each other.
That's great. Lucy, tell us that. Another disclosure, I have a budding investment in Lucy's company, but
now I'm jealous.
Yeah.
That would have been easier.
But I know the challenges, but maybe tell the audience a little bit.
Sure. I think our challenge is that everyone's looking to innovation to be part of the solution in healthcare. And so it's very easy for us to go in and talk to practices, to accountable care organizations, to employers about their diabetes challenge, and they're very curious of what we're doing. And my pushback to them is, we're all part of this innovation. We're all in this together. And I think it fits really well with the theme of this conference, that it's about collaboration. Because while we create software solutions and tools to help address those 3 areas I talked about in diabetes, of education and making management more effective and driving engagement, we need the other half of that equation. We need the organizations who have patients and have employees who have this problem. And we need them to sort of walk along with us and be part of this journey and maybe get their hands dirty a little bit and try new technologies and help us together improve the system, because we're only part of that equation. And a great example is there's an ACO, one of the pioneer ACOs we're working with in California, and they have a mandate from their CEO of we will innovate. And if you see something that will improve management here, try it. It's okay. You can take a risk, you can try new things, and they've been a tremendous partner. So we need more organizations like that.
Yeah. So one of the first questions I asked Lucy when she came to see me is I said, you're solving a really large problem. It's obviously will have a big impact on our healthcare system, but I asked her who pays, who will pay for this, and because there's somewhat of a disincentive. Can you talk a little bit about the way you see that changing and some of the things you've done to find people to collaborate and
Sure, and I think,
service?
this all relates to accountable care and how our healthcare system is changing, that unfortunately, doctors really weren't paid to make patients healthier before. And all of a sudden, there are all of these processes and programs, things like that Pioneer ACO program, where the organization is being held financially accountable for outcomes and for how efficiently they are able to provide care. And so now we have groups, either accountable care type organizations, or self-insured employers who are looking at the healthcare component of their operating expenses and saying this isn't sustainable. And by the way, I'm spending 80% of my healthcare dollars on 10% of my employee population. I need to target solutions to help them improve their health. So those are the two main groups.
That's great. And Shane, you've you've scaled one, so you know all the pain that took to get it there. But maybe talk a little bit about the same.
Yeah, sure. Well, starting a business is really, really, really hard. Yep. And whether you're doing it, inside a company like ours, whether you're doing it in one of the incubators that was spoken about just a minute ago, whether you're doing it out of your garage, however you're doing it, it's very hard, and for all the reasons I think that you're hearing up here. And so we are experiencing that daily with the companies that are part of Jackson Healthcare. And when I was saying about this question, the biggest challenge we have are finding people who can thrive in that type of an environment. I mean, entrepreneurs, and no offense to the people up here, take this as a compliment, are a little bit weird, right? They're just, they think differently, and finding people who can fit in that role and who can be in that type of a hyper flexible, hyper dynamic environment is hard. And so for us, I'd say one of the biggest challenges we face are finding the right people to get on the bus, so to speak, that can be a part of that team and that can read markets, look at products, figure out who pays, things like that, and do the things that it takes to start a business, because it's not easy.
Yeah, that would be our exact experience as well. There's a lot of great ideas, but putting all the pieces together is really the most difficult part. Partha, what challenges or frictions are you facing?
I mean, I would have to agree with Shane. One of the things that we've been really lucky with is having a really great set of mentors to build the business. So along the way, we faced a lot of challenges with capital raising, with business plan. I mean, even with the product development, and we're just now getting into revenue, so we haven't faced the sales challenges yet. But the biggest thing that we had struggled through was getting connected to the right people who had the time to commit to the business and who could meet, say, every week or every couple of weeks and take those phone calls late at night and really help along the way.
Yeah, that's great. Can you guys, we've had this sea change in healthcare called the Affordable Care Act in the last few years. Can you talk about a little bit about how that the law has maybe created opportunities or difficulties in what you're trying to do? And I'll start again with Amy.
Bonus. For us, it's actually been a fantastic thing because hospitals are trying to do things as efficiently as possible, and Buzzy is pennies per injection. So if they're trying to block needle pain, this is 2 orders of magnitude cheaper than what they're doing now. The other thing is called HCPCS, which is the survey that hospitals have to account for their performance to patients. And questions 17 through 19 deal with pain, and did your hospital do everything possible to address your pain? No one forgets when you put a vibrating bee on their arm before you do an IV stick. So we've had a number of hospitals that Buzzy has gone through virally because it's cheaper, but also hospitals are now accountable to providing good care, and part of that's pain, and this addresses it in a very memorable way. So for us, actually, it's been something that has been great.
Great. Lucy?
Right, so I mentioned this a little bit, that I think finally we have sort of the dollars lining up with the outcomes that altruistically we all think we should have been working towards, in the past in healthcare isn't it about better outcomes? But the money just wasn't set up that way, and that created a really difficult environment for always choosing the most efficient way to manage chronic diseases and getting everybody on board. I mean, it's sort of like getting everyone on the bus for chronic disease management. The providers, the patients, the organization, everybody has to be aligned with what those goals are. And if you have the financial incentives there that are coming on board, that really helps get people aligned of we're going to work on this together and we're going to commit to the difficult behavior change that's needed to impact that.
Great. Shane, how's the Affordable Care Act impacted Jackson Healthcare?
Yeah, so I would say one of the biggest impacts that it's had on our industry in general, and I think that we've felt, is the amount of uncertainty that it has created, particularly for hospitals. I mean, if you run a business at all, if you can imagine going through the last 3 or 4 years with having very little insight into how you're going to be paid, who is going to pay you, and going through these political cycles that may drastically change things, and then finally there's political certainty, and then these exchange plans coming on, and is anybody going to sign up and know whether they're going to pay their premiums, and now we're trying to figure out if they can pay their deductibles and all those sorts of things. And so one of the things I'm actually fairly optimistic about right now is that you have seen, we've kind of gotten through the exchange plans, have rolled out, some of the states have rolled out Medicaid and that sort of thing, and you almost feel like our industry is taking a little bit of a breath and going, okay, the world did not end. And some of this money is actually flowing, and I really kind of feel like now I have a little bit more solid ground on which to operate. And I think so we're seeing the last few years where especially in the hospital community, they've just kind of clinched down in face of uncertainty, where they're starting to breathe a little bit and can maybe be a little bit more aggressive in some of the things they're doing.
Sure. Partha, has the Affordable Care Act affected you at all?
Yeah, so the big emphasis on patient satisfaction and better patient outcomes has actually been a big push for premium products like ours. But the one major advantage we have is that now healthcare systems are saying, can we do this in a financially prudent way? And our product is actually one of the, I think, the only premium crutch that is cost neutral for a hospital switch. So it doesn't cost them more money. So we're able to increase their patient care for the same cost to them.
That's great. So I'll ask one final question of you guys. So if you could improve one thing about our healthcare system, what would it be and why?
Transparency. I really think if consumers had an idea about what things cost, they would be more motivated, and it would also help that shift toward personal accountability and responsibility for health. If they're the ones who have to make the decisions about the health instead of just succumbing to greater knowledge and then going passive, I think that all of us would be healthier.
Yeah. Lucy?
I think physician satisfaction is a really disturbing trend right now. Many of the physicians who I trained with who were early in their careers, and the surveys on that are just remarkable of how many people are starting their medical career and already trying to figure out how soon they can get out. Because I think it has a terrible impact on patient care, and people who've gone into medicine because they want to and they believe in improving the health of their population, and then they feel this huge burden of whether it's phase 1 of electronic medical records rolling out, and how frustrating that is and how much time it takes away from actually practicing medicine. And I think if we can fix that, it could really have a positive impact not only on the physicians, but obviously on the system and the patients and everybody involved.
That's a great point. That's a tough challenge. We're trying to wrench these efficiencies out of healthcare, but at the same time, we're making physicians feel like they're somewhat of a cog in a wheel, and that usually doesn't do much for job satisfaction. Are you seeing that, Shane, as well with your physicians?
Well, absolutely. It's study after study, and what we hear daily from our physicians is what they're doing on a day-to-day basis is not what it was when they got into their career, and it's not why they decided to become a doctor. They want to become a doctor to take care of patients, and they don't feel like they have the access and ability to do that. So we hear it all the time.
That's great. Partha, if you could change one thing, what would it be?
I think my thing is probably going to offend those of you in health IT, but the whole thing that I've been seeing whenever I go into hospitals is there's all this data, there's all these different platforms everybody has to use, and I just think we would have a better system if we did less, but we did less things better than throwing all this data and all this software at hospitals. Because there's so many EMR systems, there's so many data acquisition systems, but who's got the time at a hospital with all these patients and all the money going out and all the changes in legal, like the Affordable Care Act, to sit and analyze all the data?
Yeah, that's great. Well, I'll close by saying, you know, these guys are endeavoring to do great things, and if you get a chance to support any of the entrepreneurs, these or any others that are trying to change our healthcare system, I would encourage you to do so, whether that's investing time, money, or just giving them access to talk about what they're doing inside a healthcare system. So thank you.